Caring for children with autism. Do you know children affected with autism find it difficult to communicate and to become socialized? There are two notions about the existence of autism. One thought is that autism is due to a biochemical imbalance, and the other notion is it is a psychological disorder. The autism-affected children seldom communicate with others except to fulfill their needs. Autism spectrum disorders can be called an umbrella term since it covers classic autism, pervasive developmental disorder, PDD, and Asperger's syndrome. Autism can be termed a spectrum disorder as the intensity and the number of the symptoms of autism differs from person to person. Autism causes impairments in the people in three areas: social relationships, communication, and restricted patterns of behavior. The spectrum of autism can be classified as severely affected, less stable, and dependent on others. This also includes persons with above average intelligence and independence but lacking social skills. Autism sufferers lack a proper response to social and environmental stimulations. The affected child would be in a separate world. The child's communication will be very minimal, and he will not be able to communicate his emotions and feelings properly. Malabsorption is the most common problem noticed in autism. Autism sufferers experience structural compromise and chronic gastric inflammation in the digestive tract. The intestinal absorption is delayed due to intestinal inflammation. The specific symptoms of autism are restricted behaviors and interests, and this is even seen towards the food choices. Self-limited and restricted diets are highly noticed in the autism condition, which may cause deficiency in one or more essential nutrients. The commonly occurring deficiencies in the children suffering from autism are vitamin A, sulfate deficiency, calcium deficiency, B12 deficiency, high copper, zinc ratio, etc. There are numerous treatments available to cure the autism condition in children. Initially, nutritional supplements are offered to the child suffering from autism. This might be followed by behavioral training. In general, vitamin B12 is as a supplement. The behavioral change noticed in autism can be improved by giving suitable educational therapies, where the child is motivated to give good response to the environmental and social changes promptly. Although it is easy to say that educational therapy is good for autism patients, the children found difficult in learning the task, and they will intercept the process and show aggressive behavior to other people to avoid learning any new task. In order to improve the autism behaviors, magnesium in the form of injections are given to the autism sufferers. Within 2-4 weeks of administration of vitamin B12, autism behaviors can be reduced within 2 to 4 weeks. It can take more than 3 months for some children to respond with vitamin B12. The autism child with speech problems can be treated with dimethylglycine, DMG, for better results. DMG will improve the immune system of one's own body. Moreover, this improves frustration tolerance and eye contact. For negative attention-seeking behaviors of autism, it is advisable to eliminate the behavior by giving attention to desired behavior rather than the negative behavior.